Understanding antibiotics and antivirals. Antibiotics and antivirals are both used to treat infections, but they work in different ways. Antibiotics target bacteria, while antivirals are designed to fight viruses. These medications are crucial in managing infections but are effective only against specific types of pathogens. Antibiotics. Fighting bacterial infections. Antibiotics are designed to treat bacterial infections by either killing bacteria or inhibiting their growth. They work by targeting specific components of bacterial cells, such as cell walls or protein synthesis mechanisms. Common bacterial infections treated with antibiotics include strep throat, urinary tract infections, and tuberculosis. Antivirals. Targeting viruses. Antiviral medications are used to treat viral infections by interfering with the virus's ability to replicate inside the host cell. Unlike antibiotics, which kill bacteria, antivirals work by preventing viruses from multiplying and spreading. Antivirals are used for conditions like the flu, HIV, and herpes. Key difference: bacteria versus viruses. The primary difference between antibiotics and antivirals is the type of pathogen they target. Antibiotics are effective against bacterial infections, which are caused by single-celled organisms, while antivirals specifically target viruses, which are much smaller and require a host cell to reproduce. Antibiotics. Broad versus narrow spectrum. Some antibiotics are broad spectrum, meaning they can target a wide range of bacteria, while others are narrow spectrum and are effective against specific bacterial species. Broad-spectrum antibiotics are often used when the specific type of bacteria is unknown, but overuse can lead to antibiotic resistance. Antivirals. Specific targets for treatment. Antiviral medications are more specialized than antibiotics and are often specific to the type of virus. For example, antiretroviral drugs are used to treat HIV, while oseltamivir is used for treating the flu. Unlike antibiotics, antivirals do not cure the infection but may reduce symptoms and shorten the duration. Resistance. A growing concern. Antibiotic resistance is a significant concern in modern medicine. Overuse or misuse of antibiotics can lead to bacteria developing resistance, making infections harder to treat. While antiviral resistance is less common, it can occur, particularly with viruses like HIV or influenza, making effective treatment more challenging. Use of antibiotics in viral infections. Antibiotics are ineffective against viral infections, yet they are sometimes prescribed mistakenly for conditions like the common cold or flu. This misuse contributes to antibiotic resistance and can lead to unnecessary side effects. It's important to use antibiotics only for bacterial infections. Preventive measures for infections. While antibiotics and antivirals can treat existing infections, prevention is always better. Vaccines are a key preventive measure for both bacterial and viral infections. For example, vaccines for diseases like pneumonia, bacterial, and influenza, viral, help reduce the need for medications and prevent outbreaks. Consult healthcare providers for proper treatment. It's essential to consult healthcare providers for the proper diagnosis and treatment. They can determine whether an infection is bacterial or viral and prescribe the appropriate medication. Misuse of antibiotics and antivirals can lead to complications, making professional guidance crucial for effective treatment.